Welcome to week 27. Week 27 is now the beginning of the third trimester. You're 2/3 of the way done and you're heading for home. So welcome to the third trimester. Welcome to week 27. At week 27, your baby is over 2 pounds and now it's over a foot in length, over 12, 13 inches. You'll notice there's a big jump here because in the third trimester, we stop measuring the baby in crown rump length, which is basically crown rump length is the distance from the bottom to the head, and we actually are measuring the full length of the baby as if it was standing up. So we're talking about 12, 13 inches now and over 2 pounds as the baby continues to grow. This is the beginning of the third trimester. Unfortunately, the third trimester starts getting a little bit more difficult for people. You start losing some of that energy you had in the second trimester, but don't worry, it doesn't happen all at once. So you're still probably feeling relatively good. Also, at 27 weeks, the baby has an excellent chance of doing okay if it's born. So about 90% of babies survive at 27 weeks, and only about 10% of those survivors have severe disabilities. So I certainly don't want you to deliver at 27 weeks, but if you do, there's actually a pretty good chance that your baby's going to be okay. Interestingly, at 27 weeks, the baby can now distinguish different voices. And so this is a really important time to start talking to the baby, have the baby's dad talk to the baby, because those voices will be distinguishable, and the baby will recognize those voices when it comes out. A lot of times I'll hear my patients come in and the dad will be saying that you can tell that the baby can recognize his voice by the way it moves when he talks to it, which is actually pretty cool if you think about it. 27 weeks is also about the time that we like to do what's called 1 hour glucose tolerance test, or 1 hour GTT. This is a test that looks for diabetes. Very important to do it at the very end of the second or early third trimester. So 26, 27, 28 weeks is when we like to get that sugar test done. It's kind of an obnoxious test because you have to drink the sweet stuff and get your blood tested an hour later. But it looks to see if you've developed diabetes of pregnancy, which is a very important thing because if it's treated, everything's going to be fine. But if it's left untreated because we don't know about it, it could really lead to disaster. So very important that you do this test. It's 27 weeks. Welcome to the third trimester.